Alright, today we're going to go over antimicrobial drugs, pharmacologies, get just knocked out. What do you think the mechanism of action of antibacterial drugs are? Disruption of the bacterial cell wall, inhibition of protein synthesis, and inhibition of folic acid synthesis. What does a bactericidal mean? Kills bacteria. What does bacteriostatic mean? Keeps it from replicating. What is acquired resistance? Mutation to defend against a drug that used to work. What is a nosocomial infection? Developed in the hospital. What is cross resistance? Resistant to one class can be resistant to another class that is structurally similar. Give me some examples of antibiotic misuse that lead to resistance. Using for viral infections, using when no infection is present, using antibiotics incorrectly such as skipping doses, not taking the full antibiotic regimen. Alright, give me some example of narrow spectrum drugs. Penicillin and erythromycin. What are narrow spectrum drugs used for? They're used primarily for one bacteria type. Give me some example of broad spectrum drugs. Tetracyclines, Cephalosporins, Vancomycin. What are broad spectrum drugs effective against? Gram positive and gram negative. What are the broad spectrum drugs frequently used to treat? Infections when the offending microorganism has not been identified by culture and sensitivity. What is a big disadvantage to using broad spectrum antibiotics? More side effects. Look at this. Alright. What is a mild allergic reaction symptoms? Rash, pruritus, and hives. What are the symptoms of anaphylactic shock or severe allergy? Bronchospasms, laryngeal edema, vascular collapse, and cardiac arrest. How are we going to treat allergic reactions in general? Antihistamines, epinephrine, steroid, bronchodilator. Alright, what is a secondary infection? I'll just skip that. What are the assessments we'd see with ear toxicity? Ringing in the ears. What are the assessments or labs we see with liver toxicity? Liver enzymes, jaundice if it's late, and then AST and ALT labs. What assessments or labs we see with kidney toxicity? Kidney function, bun, creatinine, and urine output. Alright, give me some examples of penicillins. Ampicillin and amoxicillin. Alright, what are some nursing considerations we need to know about penicillin? Take entire course of antibiotics, wear your med alert allergy bracelet, increase fluid intake, take with water, take amoxicillin with food. What are the common side effects of penicillins? Nausea, vomiting, and diarrhea. And what drug interactions does penicillin have? It interacts with a contraceptive med, so you need to find a different method of contraception. All right, give me some examples of cephalosporins. Ceftriaxone or cephalexin. Tell me about the IM versions of cephalosporins. They're a painful injection, so usually mix those with lidocaine because they're like a numbing agent. Tell me about IV cephalosporins. Give as a slow push or as a piggyback. What should you eat when you take cephalosporins? What else should you eat with these? Probiotics. So, cephalosporins are at high risk for causing what type of disease? C. diff. All right. What is vancomycin used for? Widely used for serious infections like MRSA, and if you take a PO, it'll be for C. diff. How should you administer vancomycin? You want to administer it slowly. What are the major toxicities when it comes to vancomycin? Renal failure. So you want to look at bun, creatinine, and urine output. What labs are you going to collect when doing vancomycin? Peak and trough levels. When do you draw a trough level? "30 minutes before dose." When do you draw a peak level? 1 hour after dose. All right, give me some examples of tetracyclines. Doxycycline and tetracycline. What food and drug interactions do tetracyclines have? They increase the effects of digoxin and warfarin, and you don't want to take them with dairy foods, iron, or antacids. What are the side and adverse effects of tetracyclines? Hepatotoxicity, renal toxicity, and then phototoxicity. And then you should not give it to children under 8 years old because it might cause discolored teeth. When should you take tetracyclines? "1 hour before or 2 hours after food." Give me some examples of macrolides. Erythromycin and clindamycin. What are the side and adverse effects of macrolides? Hepatotoxicity and then nausea, vomiting, and diarrhea. What are the food and drug interactions of macrolides? Increased effects of warfarin and digoxin, and then if you take antacids with them, they actually reduce the absorption of macrolides. What should you take with macrolides when taking them? Take them with a full glass of water. What is clindamycin highly correlated with what disease? C. diff. What's examples of aminoglycosides? Gentamicin or Tobramycin? What is aminoglycosides used for? Serious or resistant infections. What labs do we have to monitor when taking aminoglycosides? Urine output's got to be greater than 600 milliliters a day, and then we have to draw the peak and trough levels. What are the side and adverse effects of aminoglycosides? Autotoxicity and nephrotoxicity, and these increase when you take with other auto and nephrotoxic drugs. Give me some examples of fluoroquinolones. Levofloxacin and Ciprofloxacin. What are the food and drug interactions with fluoroquinolones? Increased effects of oral diabetes medications. If you take with NSAIDs, they'll cause seizures, and you want to take them 2 hours apart from antacids, iron, and dairy. What are side and adverse effects of fluoroquinolones? Hepatotoxic, nephrotoxic, and Stevens-Johnson syndrome. All right, what do we want to encourage when someone takes fluoroquinolones? Encourage a lot of fluids, at least 2,000 milliliters a day, because it could cause crystalluria. Give me some examples of sulfonamides. TMP-SMZ and sulfazoxazole. What are the side and adverse effects of sulfonamides? Bone marrow depression, seizures, Stevens-Johnson syndrome, and nephrotoxicity. What labs are we monitoring when taking sulfonamides? We're monitoring urine output, so we want to encourage fluids. When are sulfonamides contraindicated? During the last 3 months of pregnancy. What food and drug interactions do sulfonamides have? Antacids will decrease absorption of these.